One of the predicament of development is a dwindling population. And a victim of this has been the Parsi community. To address this, the Government of India started the Jio Parsi project.
Thanks to the kindness of the government through the Ministry of Minority Affairs, we put up a proposal to create a Jio Parsi program. And the whole concept of it and this little Farohar, the happy Farohar, Jio Parsi, is to bring back that joy in life, to bring back the positivity. And while it started off as a program of medical interventions and support for medical help, because there are a lot of Parsis who cannot afford IVF or ICSI or the treatments required, we found very quickly what the ICMR, the Indian Council of Medical Research, had told us, that your real thrust should be on advocacy. We found that to be true.
Jio Parsi has two components. One is the medical component, where we reimburse any kind of treatment, again through any doctor anywhere in India, that leads to conception. So that is one aspect that we do. But the second aspect is advocacy, where we are encouraging people to marry early, because that is one big problem we are facing, that most of them marry after 30-35, where the biological clock is already ticked away, So that is one thing we encourage. We also have workshops and a lot of other events that we do.
I sat in on a workshop at Rustom Bagh, and I realized how many issues people keep quiet about until a trained counsellor, and all our counsellors are trained from TISS, Tata Institute of Social Sciences, until a trained counsellor draws them out.
We also have awareness campaigns in various activities. For example, if there is a community dinner, we go and speak over there, or we put up a stall so that people come to know. Then in many of our colonies, which are called bags, we have had parenting workshops, couple workshops, family life workshops.
We visited Dadar, the place which was given to us. There was a coordinator by the name of Pearl Mistry. So we visited her house first, we met her, she explained us beautifully, and whatever doubts we had, that all got clarified, and within minutes we had decided that we were in that program.
The advocacy team of Jio Parsi has impacted many couples successfully in conceiving. But the role of a counsellor doesn't just end there. They help them take the next step by referring them to a gynecologist.
It is very important when the couple comes to a clinic to have blood investigations, a pelvic sonography and a semen analysis. So basic medical disorders must be treated prior to conception. These investigations are done, then a basic profile and a protocol is given to the patient. More often than not, a couple only needs counseling, some advice about the menstrual cycle, the safe and the unsafe period. They are also counseled that ovulation takes place only once in a month. The egg stays alive only for 24 hours and the sperm for 48 hours once it is released. And thus, if they do not have intercourse at that particular time, they will not get pregnant. So ovulation occurs only once in a month. That means they have only 12 chances in a year to conceive.
If after trying naturally for more than a year, a couple is still unable to conceive, then Jio Parsi counsellors help the couple to undergo medical procedure called assisted reproductive technology. The various assisted reproductive technology Jio Parsi is using are IUI, ICSI and IVF.
An intrauterine insemination is a very, very basic form of ART. It is non-invasive, inexpensive, and the sperm is kept as close to the oocyte as possible with the form of a cannula. If after 5 to 6 cycles of intrauterine insemination using ovulation induction drugs and injections, the patient does not conceive, she can be counseled for the next step, which is the in vitro fertilization and intracytoplasmic sperm injection.
IVF is a very special treatment in extreme conditions. Nature has planned it in such a way that there should be at least 15-20 million good sperms to help that one sperm to fertilize. And for that reason, IVF, even if the count is 500,000 or 1 million, can help that couple to achieve a pregnancy, because in IVF, even one good sperm can be utilized by what we call intracellular injection of the sperm into the egg. Then you bypass the tube by IVF, because you bring the egg out, fertilize it, you don't need the tube, you insert it back into the uterus after a few days when it's mature to get implanted. And that is the main way or reason why IVF was initially started. Then, but at the moment there are centers where and couples naturally would like to go to a fertility clinic doing IVF. They would not even ask more questions, but just straight away say, okay, you come on this month and we'll do IVF. That is not the right approach.
Having a baby is an amazing journey, but it's not all plain sailing. It affects an individual psychologically, medically, and even financially. Geoparsi aims at providing not only psychological or medical assistance, it also assists couples with financial support.
The reimbursement that we give per couple till they conceive is up to rupees 5 lakhs. Okay, that is one thing. Another thing is, it's not only IVF or IUI treatments. Any treatment or surgery that is needed that leads to conception falls under our criteria. And the reimbursement for the fertility, the treatments that lead to conception are very expensive and they are not foolproof. Most of the times they fail. The multiple attempts have been, you have to take multiple attempts to actually conceive. So the financial reimbursement does help. It at least lightens the burden of the amount of money that the couple has to spend.
There are many factors that contribute to the success of fertility treatment. The age of the patient, the maturity, and the quality of eggs play a very important role. The biggest obstacle for women aged 30 or older may be getting pregnant in the first place. Fertility rates begin to decline gradually at age 30. Even with fertility treatment or ART, women have more difficulty getting pregnant as they age.
Fertility is best between the age 20 to 35, 15 years. That is at the peak. And if one starts planning a pregnancy, and as I already stressed, the vitamins and all, very essential, I would like to really repeat that. Then in 3 months or 4 months, nature needs for a normal, healthy couple with no problems, 3 to 4 months to allow a pregnancy to start. If there were 100 normal, healthy couples planning pregnancy, there will be about 10 or 15 lucky to fall pregnant in the first month. That too, I'm saying out a little, majority take 2 months, 3 months, 4 months. And if in that time there is no conception, with a regular frequency of contact, sex, then one should immediately think of going to a doctor.
Geoparsi is trying to influence the mindset of the community, and since its inception, Geoparsi has already seen remarkable success. But still a lot more has to be done. There's a long road ahead that still needs to be traveled.
It will be the couples who have been influenced by our workshops, by our ads, and have actually gone in for a second child. We've had quite a few couples who said, no, we are going to have only one kid, then read our articles, saw some of our ads, attended some workshops, and actually went in for the second kid. So yes, there has been success.
Today, when we've got 1 year results, we find that 1/3 of our people have been treated and had babies successfully with medical intervention. 2/3 have changed their mindset and have come to have a second child, to have a first child at the right age, thanks to our advocacy team. When the family sits down together and realizes the importance of how this program is going to change the future of the Parsis in the future, I think they will all agree to become a part of Jio Parsi.